Characteristics of a successful SLP. What makes a good SLP? Speech-language pathology can be an extremely rewarding and fulfilling career, but it can also be very demanding and just downright hard at times. Sure, there's tons of courses you can take for continuing education, but what if some of the building blocks to having a successful career had nothing to do with your clinical knowledge? In this video, we're going to talk about some characteristics that you can start working on today that can make your career much more rewarding. Let's dive in. I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Growth-minded versus fixed-minded. I recently read a book by Stanford professor and psychologist Dr. Carol Dweck titled Mindset. The entire book described the features of being growth-minded versus fixed-minded. While reading this book, many pages caused me to stop and scream to myself, "Oh my gosh, this makes so much sense." I'm sure so many other people felt the same way I did when reading, since this book can be generalized to pretty much any scenario, anywhere in life. But I wanted to highlight a few parts of this book that I felt really resonated with my work and my career, and hopefully they can provide some value to you too. According to Mindset Health, a growth mindset means that you believe your intelligence and talents can be developed over time, that they can change and evolve, and that anything can be improved through effort and learning. A fixed mindset means that you believe your intelligence and abilities are fixed, that you won't ever improve at something or change your viewpoints on something. Dr. Carol Dweck stated that fixed mindset people believe that they have a certain amount of intelligence and that's that. And then their goal becomes to look smart all the time and never look dumb. Dr. Dweck's groundbreaking research in this area demonstrated that it's more beneficial not to praise talent or abilities, but praise the process. She stated that persistence and resilience are the characteristics that should be rewarded. While effort is an important part of a growth mindset, it shouldn't be the main focus of praise, per Mindset Health. Now, one of the reasons that I wanted to discuss this topic here is that Dr. Dweck further studied the benefits of a growth mindset and discovered that it correlates to reduced burnout, depression, and anxiety. A growth mindset is correlated to higher motivation and error correction, and is also associated with lower activation in response to negative feedback. I know SLPs have really tough jobs sometimes, and burnout is so real, so please check out this book. I can't recommend this book enough. And if you're one of the fixed-minded type, perhaps adapting a few of the skills and lessons in this book can really help you out of your rut and accelerate your career. I recently was speaking with an SLP who told me that she was giving up on her goal of being in a leadership position at her hospital. She said that the people that ended up getting promoted just had that it factor and were destined to move up. She said that despite applying for positions several times, she just never got promoted. I asked what courses about leadership or skills did she possess to make her a leader. Well, none, she said. Either you got it or you don't. I loved having this conversation because I always believe people can grow and change. It can be surprising to find out that talent alone is not the only thing that often determines success. Hard work and persistence towards accomplishing a goal is truly what's required to excel. It may sound like a lot of woo-woo, but believing in your own ability to grow, combined with putting in the work and adapting the plan as needed, are most likely the most important determining factors in your own success. Believing that you can become more than you are and doing the required work is often a learned trait for many individuals. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about what makes a good SLP? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Seek out mentorship and multidisciplinary care. I recently heard a talk by Damon John of Shark Tank and FUBU fame all about the power of mentors and mentorship. He stated that mentorship is one of the most important factors in his business, and when people ask him how he became so successful, he said he did it with a lot of grit, passion, failures, and mentors. He further stated that 67% of businesses reported an increase in productivity due to mentoring, and CEOs in formal mentoring programs reported that 74% of mentors had helped them avoid costly mistakes, 84% became more proficient in their roles, and 69% were making better decisions. Now I get it. You're asking how this correlates to speech pathology, and in my humble opinion, I think it does very strongly. Mentorship is a word that has many different meanings and connotations to a variety of people. It can be a paid mentor or free mentor, someone that mentors from afar or via a large group. They can be in your same profession or a colleague in a different field. The plethora of definitions truly does not matter. All that matters here is recognizing the importance they can have on your growth and career. It's most important first and foremost to get crystal clear on what your goals are, and then seek out mentorship that can help you get there faster. For as long as I have owned my own companies, I have had mentors. Well, why, do you ask? Because I have a master's degree in speech pathology, I knew nothing about business. I only knew that I had identified some problems, and I also had ideas on how to fix them, but I had no idea how to execute on my own ideas. Mentorship is the single biggest factor that has allowed me to grow in my career and business, and I can't recommend enough for you to find one in an area that you wish to grow and evolve in. Do you want to work in a different setting? Find a mentor to help you learn that area. Do you want to specialize in something? Find a mentor to help you get started. Mentors help to give you a starting point, help you clarify the next steps to take, and can also share mistakes they learned along the way to help pave an easier road for you. The third characteristic I want to discuss is being a patient-focused SLP. It's been widely discussed that the entire medical field is moving more towards a patient-centered model. This is a wonderful movement for both patients and clinicians working with them. For so long, clinicians and medical professionals would often think we have to do things to our patients, put them on things, but we don't do anything to them. We make treatment plans with them. The New England Journal of Medicine published an article containing several common elements that many models of patient-centered care have in common. These can affect the way healthcare systems are designed and also the way care is delivered. They include the healthcare system's mission, vision, values, leadership, and quality improvement drivers are aligned to patient-centered goals. Care is collaborative, coordinated, and accessible. The right care is provided at the right time and the right place. Care focuses on physical comfort as well as emotional well-being. Patient and family preferences, values, cultural traditions, and socioeconomic conditions are respected. Patients and their families are an expected part of the care team and play a role in decisions at the patient and system level. The presence of family members in the care setting is encouraged and facilitated. Information is shared fully and in a timely manner so that patients and their family members can make informed decisions. I used to have a lot of anxiety over making the right decisions for patients, until I realized that the responsibility does not completely fall on my shoulders. SLPs often work in consultative roles, and it's our job to consider all of the aforementioned elements and present the options to the family and the entire medical team. Once I realized that there was shared decision-making between all of the parties involved, the burden was really taken off of me, which allowed me to really think critically about the best recommendations I could bring to the table. I was talking with a colleague the other day that works at a very prestigious institution. She was saying that most of their decision-making is now done in teams. She said they have a weekly dysphagia team meeting where they discuss each patient, and she said it's become much more collaborative and efficient to have the entire team weigh in on decisions in a patient-centered manner instead of just one professional making individual recommendations without knowing what the other professions are considering or its impact. She said she sees this really becoming the wave of the future to allow for patient-centered care in an effective and efficient manner. If you'd like to dive into some detailed resources, webinars for ASHA CEUs, and a growth-minded, thriving community to grow your knowledge, I invite you to check out the MedSLP Collective. We have a robust and vibrant community of SLPs and mentors to help you out with your toughest clinical cases. Head over to MedSLPcollective.com now to get your hands on this. The link will be in the description below.